Through our more than 40 years of service, our mission has evolved from providing effective, evidence-based mental health and substance abuse treatment coordinated with primary medical care to now providing integrated behavioral health and primary care services in one location. We also provide safe, permanent housing, employment assistance, literacy enhancement, and support services to people in our community coping with the stressors of illness. Our services help people live productive lives in their communities. Without health insurance, people simply can't afford health care. They use hospital emergency rooms as their primary source of health care, and they're more likely to die earlier than the general population. DCC's consumers have difficulty accessing free or subsidized primary care because they can't even afford very low copays. They don't have insurance for medications, they lack transportation, and they need assistance to enroll in Medicaid. Public government dollars fund many of our programs, but we need additional financial support if we're going to be able to support our community with holistic care. DCC provides clinical services in addition to housing and employment support. We find creative ways to be a full-service organization that revitalizes the community and rebuilds lives. Since so many people are released from the Michigan prison system to DCC service area, we have developed real expertise in jail diversion programs. DCC is the community mental health provider for the mental health court in Wayne County. This collaboration includes the local circuit court and Detroit-Wayne Community Mental Health Authority. We offer treatment options to the court by providing alternatives to prosecution. And DCC is the first community mental health agency to have received the National Health Service Corps designation in Wayne County. The multidisciplinary staff of DCC includes psychiatrists, nurses, social workers, housing and employment specialists, and rehabilitation therapists. These are all professionals dedicated to helping people cope with illness, addiction, poverty, the criminal justice system, and homelessness. Our staff has built a safety net that involves many different efforts. DCC routinely undergoes a strategic planning process to develop and update its 3-year plan. The strategic plan is DCC's blueprint for addressing its business needs, and it helps to ensure that we are fulfilling our mission. It's a team effort that builds consensus on our future. To measure success, we keep track of recidivism rates to hospital and prison, the number of consumers who enroll in school and successfully find a job, and the number of people who remain in independent housing situations for 6 months or more. We use satisfaction surveys and results of quality audits to refine our clinical strategies. This means that we are continually improving our quality outcomes. DCC has been a safety net provider for behavioral health, public housing, and many other services for over 40 years. Our agency alone serves more than 4,000 people each year. Some of our neighbors in Detroit are concerned about having an agency like DCC on such a highly visible corner in Midtown. They think our presence will negatively impact the community and even prevent successful businesses from relocating to the area. They don't understand that our work is designed to stabilize the community. As they learn to manage their illness, our citizens are gaining confidence and self-reliance, returning to full and assured lives within the community. In DCC's community reentry programs, The recidivism rate is below 10%, which is well below Michigan's average. And our housing outreach program provides services to more than 1,000 people every year. Dozens of students attend our literacy program every year to improve their reading, writing, and math skills. This helps them in so many areas of their life, from completing a job application to reading a prescription or telling time. We have also been successful in securing a tax credit community revitalization project that will provide 27 one-bedroom apartments for our homeless clients, primarily those who are veterans. There's a growing need to educate the community about the stigma associated with mental illness. Stigma is an attempt to label a particular group of people as less worthy of respect than others. It's a mark of shame or disapproval that results in discrimination. It leads to inadequate insurance coverage for mental health services. It leads to fear, mistrust, and violence against people living with mental illness and their families. And it leads to family and friends turning their backs on people with mental illness. DCC is working to end this stigma through education, treatment, and support services. We would use additional resources to offer expanded health services to our community's most vulnerable population. We would be able to develop a more comprehensive health center with mental health and substance abuse services, as well as primary care, dental care, case management, and primary prevention classes. We're also still searching for safe, permanent housing for the homeless, and additional resources would allow us to expand our housing services and focus on new residential developments for this vulnerable population. We know that families and children are among the fastest growing homeless population. Many homeless people who need treatment never receive medical care. They have difficulty securing health care for themselves and for their children. They may not know where to find health care providers. They lack transportation, or they may be missing a simple ID. But the most common obstacle to access is cost. Additional resources would allow us to impact the community in a truly significant way by expanding our wraparound services, supporting families with preventative health care, and developing new, safe, and affordable housing options.